want to welcome everybody here. I think this is our sixth meeting with these health district employees. And we're glad you're here this morning. I think today's agenda is a little bit lighter than the prior five, so we'll probably be here for a little bit, not too much past 10 or even if we make it to 10. And I'm going to give you a couple of program updates. We've made some progress in the last week, right? It's been about a week since we last met. And so we'll share some of those updates with you this morning, see if there's any concerns from the employees, and then progress forward. So we have our team here with us, some of the team members, Steve Vieira in the front, and Yvonne McCaney, our Human Resources Director. We have Miles Risley, our City Attorney somewhere, there he is. And then Jenny Dorsey is here somewhere from the county. Jenny, there you are, okay. Is Francisco here, just you, Jenny?
Just me.
Okay. And Chris Anderson and Valencia from our innovation team that are helping us with some best practice analysis and keeping the work plan really going forward. So we appreciate you, Chris and Valencia. And I think that's it. Am I missing anybody? We have our communications/IT team here with us as well. And just as a reminder, our meetings this morning are live broadcast on YouTube and Facebook.
Yes.
They're also being recorded so that if an employee is not here this morning, they want to see what we said, or if we want to see what we said, we can refer back to these recordings. So we appreciate that. Last week we had 30 viewers through the meeting, which is good. So there's a lot of good interest out there. And again, I don't know if I said it, but I'm Peter Snoney, the city manager, and it's a pleasure to see you this morning and talk about the progress we're making. So this week we talked to City Council. I did the city manager's report. And we gave an update on what we've been doing. It had been a couple of weeks, I think, before or since we had talked to them. So one thing that I started off with that we know in this room, but I thought it'd be good to repeat, is that we're moving to a separate health department of the city. And City Council approved that for 3 reasons, right? And what are those? Better health outcomes for the community is one. We know that we have a high obesity rate, high diabetes rate. And we're not providing some of those health services that you all brought to my attention, or we talked about as a team, like dental services, mental health services, dietetic type services. So we want better health outcomes for the community. We want better use of our taxpayer dollars. We know that there's some redundancy and a lot of inefficiency in the current business model that we're using, right? And so we have to be mindful in our business of the taxpayer. They're the ones that provide us our resources primarily. And so better use of taxpayer dollars to provide health services. And then the third one that is an important one for this group is better work environment, right, for you all. I told the council one impact of having a district and having 2 entities that have to work side by side that have 2 different rules is the pay ranges for the health district employees on both sides really haven't been adjusted, or if they have, they haven't been adjusted appropriately over the years. That means the wages generally are lower than what they should be, and so that's one of the first things Yvonne's looking at. So that's just one example of a better work environment for you all. So we talked about that with the City Council. I thought it'd be good to repeat it this morning so we can stay focused on why we're doing this. Our communications department, we had Deanna McQueen here last week, but we launched a new health communications, we'll call it a hub or a web, I guess a web page, if you will. And we gave you all the web link last week. Is it internal only still? There was some talk about making it external as well?
Yeah, 2. So we'll have 2 external for the public and then
okay. The internal one for the city employees is probably www.cctexas.com/health updates. Well, it looks like the same on this paper. Is that the internal one? That's the internal? That's our internal one for you all. cctexas.com/health updates. Has anybody looked at it since last week? Nobody's looked at it?
Yes.
Oh, okay. I didn't see anything. Okay, good. Well, we want it to be a useful tool for you, so if there's improvements that need to be made to it, let us know, and we can do that. Okay, so we're going to give you a couple of updates here. An important one is the transition of various programs from the district to the city. And I told City Council, we know we have 10 primary programs in our operation today. 10 programs is other programs like administration, and there was one other one, but we're looking in earnest to develop a real concrete timeline to see when do we move some of those programs over to the city department. And so the goal is before the Christmas break, we'll have that timeline. That we can say, okay, we have these 10 programs that are pretty much in the health district. By this time, we'll move these, as an example, these 2 to the city department. And then by this date, we'll move these. And then by this date, these, right? We know it's going to be a gradual transition. We already said that. We know that we're not going to transition everything from the district to the city on January 18, but rather we're going to do them incrementally. The easier ones, the ones that have less complication, if you will come first, and those that are more complicated, is funding outside of the general fund from the city or the county, i.e. grants, right, those will come second. Unless it's an easier, smaller grant, like TB, tuberculosis, or the WIC is another good example. And so, to that end, next week is Commissioners Court. Their bi-weekly meeting for the month, I guess, or is it once a month they meet? Bi-weekly? Twice a month. So next week is their meeting for December. We're working, Steve, myself, working to give Jenny a lot of material so that they can have an update next week. The Commissioners Court, most likely, and Jenny will talk about this as well, are going to talk about the health district transition. And so we're going to be providing Jenny some of this material I just talked to you about, a timeline, and what the transition plan looks like with some dates. Right, Steve? Also at Commissioners Court, there may be more conversation from the commissioners. I know individually some of them are talking to me. Conversations about the city taking over the entire district service delivery, and then the county contracting with the city for the city to provide services in certain areas of the county. Is that a fair statement, Jenny?
If they're talking to you, I'm not there, but.
Okay. Yes, and that's one of the topics we've talked about. It's one of the models that we know. We know the city's going to create a separate department, that's for sure. The city council approved that. But what happens to the district and the county part of it, there's a couple of options, and we talked about those already. That one is that the city department takes all the service delivery responsibility, and then New Essex County would contract with us for services and maybe unincorporated parts of the county, or in some of those rural towns like Van Cay, Albuquerque, and so on. Right, and then the other option is for the district to remain with the county and to provide services to those areas. And then I guess the third one is the county sets up its own department. So those are being worked on next week at Commissioners Court. More conversation will come up with that. Okay, so let's talk about those 5. Let's talk about the positions. So just as a reminder, the city health department will have a director. Be an executive director like all of our departments, right? There'll most likely be an assistant. There will be an assistant director as well. So the director position, we're going to use a national recruiter, or a recruiter that we use. A recruiter that we use for our executives from time to time. They'll be recruiting nationally, statewide, and locally. They're working on what we call a brochure or a pamphlet that describes the job, the community, that type of thing. Once they have that printed material, they'll launch the search, which we expect will be one in January.
It should be launched next week. We submitted the brochure yesterday.
Okay. Okay, good. So the brochure has been submitted, which is a good step to move that forward. So the executive recruitment will begin in December, right? And that's critical because we want to make sure we have that executive level director or direction for the department. So we know about that one. One that impacts probably some folks in this room are the 5 management positions or managerial division type head positions that we posted for 2 weeks, and that were posted only internally, right? And that closed last Friday, and we had applicants for every one of those 5 areas. In some cases there were 2 applicants. Was it in all cases there were 2?
Yes.
Okay, in all cases 2 people applied for those positions. So the next step is interviews, which could be as early as next week. And individuals that applied will be notified, just like you were when you interviewed back in the day, probably. We're putting together a panel right now. That's the city's business process, where to hire somebody, we set up a panel to conduct the interview. It's not just one person. And that panel is pretty much the deciding factor. There may be an extraneous outlier example out there, but by and large, our business process is what the panel sees and thinks is the strongest candidate. That's who we go with. We don't we don't have a panel interview people and then somebody, like a director or somebody like myself, say, you know what, I think we're gonna go with that person. Right, so the panel is important. We're putting that together now. We've been giving it some thought. Right now, the panel members will include Yvonne and Steve, and then we're going to get an external healthcare professional to be that third person. We may have a fourth, but it's probably looking like three. Probably most likely three. So we'll get a healthcare professional to give some, what is it, objectivity? Insight, right? I like that word. To give some insight, but non-biased insight.
Correct.
That's the word I was trying to come up with, so we got two good words there. So non-biased insight to help gauge the interview process. And then we'll probably be making selections pretty soon thereafter, right?
Yeah.
Okay, so that's exciting because what that means is then we can advance to get job postings open for the positions that are within that program area, right? And most likely we'll follow the timeline of how the departments come over, but not necessarily, right? So, like as divisions come over to the city side, we'll focus on those employee teams to interview first, correct? Right. But not necessarily in all cases, so. Okay, so what do you all think of that? It looks like even with Omicron, we're gonna be able to take, a lot of you, I hope, and you'll take that week between Christmas and New Year's off, right? So there'll be, what do we have, next week, and then the week after, and then there's a Christmas, New Year break. So over the next 2 weeks, we'll get some good activity in terms of how we move forward, right? I know a lot of you are not as worried because we're over communicating with you and we're making sure you're part of this transition. But still, I would imagine there's a little bit of worriness there, so we're trying to manage that the best we can. And remember those 3 goals, that's why we're doing this. We're all, you all are healthcare professionals, and once we get past this, then we move forward pretty quickly in the January, February timeframe. So some of us will know before the Christmas break how the direction's looking, and then we'll resume in January, those other team members, okay? Okay, so was there a question? Yes, ma'am.
Those county employees that are housed in here, once your January plan comes along, do you plan to kick us out of here?
No. Yeah, what was your name?
Minga.
Minga. So Minga asked, hey, those county employees that have office space in the building or use clinical space here, what happens on the 18th if we don't have everything resolved? The answer is nobody's getting kicked out. We stay here and we'll work with Nueces County to have some type of a lease agreement to keep the employees here. So one key thing also in those 3 pillars of better health outcomes, better use of taxpayer, better work environment. A 4th overarching goal is no interruption in service. So to kick somebody out would interrupt service. We're not going to do that. So no interruption in service. Thank you, Minga, for bringing that up. That's an important one. We'll work with Nueces County to make sure that doesn't happen. Okay, were there any other questions on kind of the employee aspect of it? Yes, ma'am?
Yes, I'm Priscilla. I had a question. So these positions that you're talking about, of course, we're going to phase in those pre-existing positions. But what if certain areas, maybe we feel like we're understaffed and there's other potential for other opportunities, other positions? Would those be phased in at a later time, like a different phase? Or would we be opening up something that's like, well, we need more positions within this department or this area?
Right, okay, that's a great question, Griselda. Thank you for being a great participant in our conversations here. So Griselda's question was, are we just taking are we doing the copy-paste special? Or are we gonna look at, maybe we need more people, more bodies, and different position types? And the answer is the latter, it's the B choice. We're not just gonna take the employees that we have today and move them over to the city, necessarily. What we talked about is we're going to sit down with employee work groups. What group do you work in, Priscilla?
Well, I'm part of the central accounting right now.
Accounting, that's okay, even that one's important. So we're going to meet with all the accounting, budget, internal folks that help keep the business going forward. And remember we have 2 types of focus groups, or employee work groups. One is on overarching areas like the building aesthetics and safety and security. And then the other is each of the individual organizations that you work in, or program areas or divisions. We're going to be meeting with you as employees just in those groups to see, okay, what do we do today? Where are our assets? Who are our employees? What do you think of what you do? Do we need more people? Do we need fewer? Do we need different type? Do we need different equipment? Like somebody was telling me last week, we need software to manage, I forget what the program, but we're using Excel spreadsheets or pieces of paper to track data. And we should be using a piece of software, right? So those are going to be critical parts of the transition. And Priscilla had a good question, which is that. So we'll be meeting with the employee work groups with that division head that we hire. So the progression is, let's get the division head or the program head hired. Then we bring the teams of employees just in those programs together with people like Chris Anderson and Valencia and Steve. I may even be in some of them. And let's talk about the service delivery that unit does. It could be an internal service function, even just like Priscilla said, accounting. And then remember, we talked about innovation, right? We want to see, is there a way we should be doing something differently, or maybe not even at all? All those questions to these brainstorming sessions are going to help us see. We're also looking at best practices from 9 cities in Texas that we want to kind of benchmark ourselves against. That includes the 7 cities above us in population, so Dallas, Fort Worth, Austin, San Antonio, Houston, and El Paso, and Arlington, and then 2 others. Let's see, there was Brownsville and what was the other one? Amarillo. Okay, good. Yeah, Brownsville and Amarillo. Brownsville because I recently made a good business connection with their city manager and health director, and they're doing a lot of innovative things down there. And then Amarillo, because they have a model where the city has the health department and they actually service by contract 2 counties that the city is geographically placed in. So 7 cities above us, we in our business we look at those because they're bigger and they may be doing things already. And then those other 2 cities. And then also, though, we talked about this, we may be doing something that they're not. Just because they're doing something or not doing something doesn't mean we won't do it, right? But we look at them just for kind of peer review. And so that's a long answer to your question, Priscilla, but yes. So Yvonne will be part of those, or an HR person will be part of those reviews for that reason. And also pay, we looked at as well, the pay ranges.
Right, so I was curious on the second part to my question.
Okay.
Kind of like the reason why I was asking is because, our existing positions, there may be, possibilities for maybe like a promotion or something that maybe, that we would want to consider, or maybe bringing our accounting people over, at their level. So if we apply for one position, but if something better comes along, possibly, I'm just saying, like at some point, thinking optimistically, right? What would happen? What do you think would happen in this situation?
Yeah, so I think what's going to happen is we need to sit down with the employees first before we post any of the team positions.
Kind of outline.
Right, so that exact scenario you just talked about doesn't happen, because that can cause stress and anxiety and may not have the best outcome, right? So the plan is, and that's what Chris is helping us on in Valencia, when do we start doing this, and for what area first, second and third? So the first step is fill the division head, then assemble a team, what was pretty much going to be us out of here, and sit down with the employee groups, the employees in that work group, in that program area. Like in the TV area, or the WIC, or the accounting administration side, and talk out what do we do today, what positions do we need, how does the county, in some cases the county has a unique position for whatever reason that the city doesn't have, but maybe we need a position like that in the city operation. That's another example. We're also going to bring in, hey, this is how they do it in 9 cities in Texas, and we know for a fact these 2 are the leaders, that type of thing. So after those conversations, that could take 2 or 3, or maybe even 1, 2, or 3, I imagine, work sessions. Then we say, okay, here's the business plan for that operation. We need these X number of positions, here's the titles, and then we go ahead and post them, then the employees know. Yeah, thank you for walking us through that. Okay, any other questions on the employee part of this? Yes, sir?
So this speaks to grants, but some grants that we have now service counties outside of Nueces County, so Cleaver, going Randus, Vigo. In the new health department that the city will be creating, if a contract was to be created with Nueces County, would the city also be okay with servicing counties outside of Nueces County as a part of a grant?
Yes, that's it. And tell me your first name again?
Kevin?
Kevin, yes. Kevin asked a question in case somebody couldn't hear it for the electronic group up there. The question is, if we have a grant today that provides services to more than just Nueces County, and the city takes over that function, the city department, will we still service the county, outside counties other than Nueces County? And the answer is yes, we will do that. And the answer is yes, we will do that. So some examples of why that's a quick yes is we do that today. If you look at the city's water operation, the city's in the business for Nueces County of providing all the water, right? We also do wastewater, sewer service. But we don't do that just for Nueces County. We do it for 7 other counties in the region. We're the regional water provider. So if we have a grant, especially a grant, and it's one that targets multiple counties outside of Nueces County, we'll continue to do that. We're using that regional impact. There's probably other examples that we have today in the city where we're doing that. So that's a good question, Kevin, thank you. Yes, ma'am?
When will you guys have a decision on like what new programs the new health department will offer?
That's a good, right, that'll probably be towards the end of the analysis, I would imagine. The new programs, we know that, and Chris, is a focus group, is one of the focus groups on that? What should we be doing differently? I don't have the
On
list here.
programs, no.
Yeah.
We've done the program assessment based on the other 9 cities. And so
Okay.
once we start meeting with each of the division heads, then they come up with.
Yeah, come on in. I think part of the, tell me your first name again?
Catherine?
Catherine's question was, as we talk about innovation and not using the copy-paste special program, how do we know when we're going to be adding new operations? Because I'm thinking about, you may not be thinking this necessarily, but what if I want to apply for that position versus the current one, right? So somehow we have to probably work that in sooner rather than later, because just in my conversations informally with you all as the meetings break here before we leave, both weeks employees have come up to me and said, hey, we really should be doing this, like dental health, dental services, dental health. The city was in the business of doing that back in the day, but we stopped for whatever reason. Well, the one I brought up when we talked about innovation, mental health, that's a big problem, but I don't think this operation doesn't, do we have any mental health? Right, no, so we have to, so as employees, we have to see when the new programs come in. And it could be that you apply for, interview, and take a job, and then you see another posting because of a new innovative program we do, and you say, man, I think I'm going to apply for that one. That's okay. And that may be some of the cases. We have to kind of do this incrementally. I think first is, let's see what programs we have, and do we have to add positions for it, or it takes them away? And then how much financial flexibility do we have to add new? And the new initiatives, we may add some right away in this fiscal year, but some may come in year 2, the next fall's budget, FY 2023, I guess, when we have availability to add more financial resources. Because of things like mental health services, that's something I think we should be doing, and but we don't have any money budgeted today, so we have to see, is there a grant out there, or do we need more general fund money? And we can answer those questions as we progress through time. So it could be that you apply for your current job, that's the one you take, and it'll be okay if there's a new job that comes out, and you say, you know what, I think I'm going to apply for that. So good question. Chris, I wanted to ask Chris the question, in those, how many work groups do we have, 10?
For the, we don't have a number yet because
Okay.
we're going through the org chart to determine what number of each contacts we're going to meet with, so we're
Okay.
getting that information.
But how many different types of work groups do people sign up for?
The voluntary work groups,
Yeah.
8. So that's the employee,
Okay.
yeah. The employee
Okay, so
work
in those eight employee work groups, is there a focus on innovation in terms of the
innovation.
program area though?
Yeah, definitely, and Catherine, yeah. So within the innovation group, we're looking at everything. So it would be operational efficiencies, it would be waste, it would be, well, I visited, or a friend of mine or an old colleague works in a different health department or health district, and they do this, and they have this program, why don't we have it? So even though we have the employee focus groups, and now all employee focus groups are going to be kind of capped at this point because the registration closed last week, even though that's the case, if you all have ideas, or if other employees have ideas, even if they didn't sign up for an employee focus group, if you have something, an idea, anything, email it to us. You can email it to any of the facilitators if it fits within their focus area. And you all saw all of the different employee focus groups and their descriptions. So take another look at that. It was attached to the email that Yvonne sent a couple of weeks ago. Take a look at that again and just to understand what each of the employee focus groups are doing, what their focuses are, foci, whatever. And make sure that if you have inputs or feedback, email that facilitator. And then last point, sorry, when we start meeting with each of the other employee groups, that would be like the division areas, kind of like Peter was talking about. That's when we can have those conversations about what services to add, delete, what have you.
Thank you, Chris. Okay, do we have any more questions on the employee aspect of the transition? Personnel part of it? Yes, ma'am?
It's not a question, but
Okay.
just an answer. I know you were asking about mental health.
Yes.
We actually do have a mental health in the city budget. It's under Fund 40, but it's just a small amount of the budget that's allocated. I think it's for outside contract.
Outside contractors, okay, maybe that, what is that, the nonprofit that's here in town? The HM,
I don't know who it
Okay.
is. It's just in the budget because it affects our budget at the end of the year.
okay. So that's good correction to the tapes there, that we do have a small amount of money in our budget for mental health, but it's only for our contractor to contractual services, no real program or staff or focus. Very good, thank you for that correction. Okay, let's talk a little bit, let's pick up from where Chris left off. We're going to talk about those employee focus groups. So remember, there's two different types of employee focus groups. The ones that are where you work today, your program area like WIC or accounting or tuberculosis, TB or HIV, STD testing. Those focus groups are going to be meeting with employees to talk about how do we move that unit forward. Is it the same? Is it better? Is it less? That type of thing. But then we realized after talking with you and hearing your input, we need other focus groups. So we have 8 other focus groups that focus on big picture transition items. And examples include the building. You know, we heard a lot of this building, the work environment, the physical space, security in the parking lot, the fact that there's no fence protecting your vehicles, that type of thing. There's a total of 8 work groups. And the good news is that you all, I have a stat here, just about 70% of you have not only signed up, but you signed up to be on 2 work groups, right? So we applaud you for that, that's great, and it shows a lot of interest in you. And you can't see it, Chris is back there clapping. And we talked about that also, that's kind of like a 5th goal, or 5th guiding principle on how we move to the new department. The 4th one I talked about is no interruption, but the 5th one is you all, the professionals, and you're going to help us do this. Because you know best, you know what you're doing today, you know where everything is, and what we haven't been doing or what we're missing. So these work groups so you all have signed up, 2/3 of you, almost 70% have signed up to be on 2 focus groups, so that's great. And Chris, last week talked about, in some cases, you had signed up for 3, and I think we've worked that through where we've kept you to just 2 so you can focus. And Chris has been looking at, Chris and Valencia is looking at your schedules, and this week putting together kind of a master schedule of your all's schedules so that he can start scheduling meetings beginning next week. And remember that each focus group, each of those 8 focus groups has a team lead, and so that team lead will be working with you all as well with Chris. So Chris, as soon as next week, I guess some of the focus groups will start meeting?
That's right.
Okay. Okay, so that's great. So so stay tuned for that, keep your interest up. Is there anything else on that, Chris, on the focus groups? Okay, so next week, some of them, it may not be all 8, but next week they will begin, and they're going to be based on your all schedules and that team lead. So they could be virtual, WebEx, some could be half WebEx, half in person, others could be all in person. It's going to be up to the work groups themselves, right?
Going forward, so just if I can add a note.
So for those first meetings, we're calling them the kickoff meetings. I'm sure y'all have heard that term before. Since Valencia and I will be taking place in every single one of them, the first one will likely be WebEx, but then going forward, as you work with your facilitator and your group, I think it would be great if you all are able and have the flexibility to meet in person safely, then for sure do that. But the first one is likely going to be WebEx.
Yes, sir, thank you. Okay, and then one other type of focus group out there we just want to remind you about, I reminded the City Council about it this past Tuesday, is a healthcare professional work group. So as we talked, our City Council took the vote that Tuesday a couple of weeks ago. Almost immediately we were getting phone calls, and the council was from professionals out in the community, partner entities of ours, that said, hey, can I sit down with you to talk about how I think the new department should be, or what the city could focus on in a particular area. And so there was a lot of interest, so we said, you know what, we're going to put together a healthcare professional work group, and there'll be several meetings with those professionals. There's people from partner agencies like the Coastal Bend Wellness Foundation. Does anybody work with them here in this room? Or, right, some of you already, yeah, quite a few people. Krista Spahn, right, the big hospital here. Driscoll Children's Hospital, Mary Dell Peterson. Dr. Peterson actually called me personally and expressed interest in doing that. Corpus Christi Medical Center, or Doctors Regional, they've expressed interest. We have the Women's and Men's Health Services of the Coastal Bend. Does anybody work with that group? Right, they actually spoke at City Council. Actually, I was at lunch one day, and they tracked Sonia and me down, just recognizing us, I guess, from TV. I hadn't met the person before. But they said, hey, we've been for years wanting to talk to you all, and can we talk to you now? And so there'll be individuals from that agency as well. And then the American Heart Association. So that's 7, we see 2, 4, that looks like about 6 agencies, but there may be more. So I think, I don't know if it's going to be in December or January, but soon we'll start meeting with those, that healthcare professional work group as well, just to kind of get some more ideas. We talked about benchmarking against those 9 Texas cities, but we have a lot of professionals right here in our city and county, and so we'll be hearing from them as well. They have ideas that they want us to hear, and see how do we incorporate that into the new health department. Any questions on that? Okay, good. Then the last thing I'm going to cover before we have Jenny Dorsey, who's going to speak a little bit on, if you want to, Jenny, on some of the county updates, is the schedule. So today is I didn't wear my watch today. What's the date today? 10th. I forgot it. So today's the 10th. Next week, the 17th, we'll be here again with the employees. And then December 23rd, Thursday, we're going to meet with you on Thursday because, are we open on Thursday? Okay, that's not Christmas Eve, the 24th. So the Thursday we'll be meeting here because the next day is Christmas Eve, and that's a city, is that a city holiday, Christmas Eve?
Yes.
Right, okay, the 24th or the 5th?
Christmas is observed on the 24th.
Okay, so the 24th is a city holiday, so we'll be closed, so, but we do want to meet and give you an update because we know in the next 2 weeks we're going to be, more progress will be happening. So next week, the 17th, we'll meet on Friday, but then the following week, we'll meet on Thursday. Because Friday is the holiday, observed holiday. And then there'll be no meeting the week of December 31st. That's the week where the city is closed. Non-essential services, and all employees have that week off. There is some leave time that you have to use, but there's an additional holiday that was put in the schedule in our calendar this year. And so non-essential services have that whole week between Christmas and New Year's off. And we'll work with Annette and Louise, because I think a lot of you will be able to observe that week. Omicron, we haven't heard too much about it in recent times, but our case count, Lewis, is what? It's low in the 40s still. It was in the 60s though, a couple of days.
40, 30, 40.
That's good. So the case count for new viruses, new infections, if you will, for coronavirus is in the 40s, which is good. So if that holds, we may get that break with our families during that week. So no meetings that week of December 31st, and then January 7th will be our first meeting in the new year. January 7th, sorry?
January 3rd.
January 3rd, okay, sorry. January 3rd, what is the 7th, a typo?
Yes, sir.
Okay, January. Okay, so January 3rd, Friday?
Yes,
Friday?
Yes,
okay, Friday, January 3rd. So just to let you know, if you want to pencil those in on your calendar. So just to recap, what's that?
Monday.
Monday, yeah.
January 30th is Monday.
Oh, 7th is
It is 7, right?
Yes, sir.
Okay. Yeah, never mind. So the 7th then. Okay, so here's the lineup. So today's the 10th. Next week we're going to meet Friday, the 17th. Then the 23rd, for the week after that, that's a Thursday. Then no meetings that week of December, between Christmas and New Year's, no meetings. But then January 7th, we'll be back to talk to you. And, okay, so that's the schedule. Any questions on it? Okay, we do appreciate, I do, coming here. We appreciate the attendance and the energy that you all have. As I said, that fifth element is you all being part of the success in the transition, so this is one step in doing that. So great questions like you all have, and participating and being here is important, and I want to thank you for that. Jenny, I'm going to have turn the mic over to you. Jenny Dorsey is a county attorney, and she's been assigned negotiator for Commissioner's Court, and so we're going to have her give a quick update.
Very short, very short. For those of you who might be considering moving or whatnot, next week on the 15th, the Commissioner's Court is going to have some presentations, and they will hopefully be making, or maybe be making some decisions if they believe they have enough information. May I suggest after that, that whoever's interested participate in a Zoom call with my office and the both retirement systems. If you have questions, we're going to have both retirement systems there listening to each other and talking to you. And then if you want to set up, they're very, very, very available. They will talk to you. And then after that Zoom meeting, if you want to have individual, case-specific conversations with them, they are happy to talk to you. So they will be presenting to Commissioner's Court. If you tune in for that, you'll have a preliminary. You may know better what questions you want to ask at the follow-up phone call or Zoom call. Other than that, the decisions, we've gathered information. We are talking about the legalities of everything, where questions still remain, and we'll be presenting that information. The legality part will be an executive, so that's not going to be, in the open session. But I would invite you to listen, if you can, to Commissioner's Court on the 15th.
Jenny, I have a question. On the issue in the email that I sent you, do you think that's something that the two retirement systems can do?
The retirement programs are set mostly by statute. So if they can do it, it'll be there, and the representatives will be able to tell you that answer. If it's not allowed by statute, then if it's possible to do it outside of that, sometimes statutes say you can do these things and other things too. A lot of times statutes are pretty exclusive. If they say you can do this, usually they say this is the only way you can do this. Does that make sense? Okay. And I'm not the insurance, I'm not the retirement guru, so I won't pretend to do that. That's why we're going to get the representatives for you guys. Yes?
Are you sending a Zoom link to the employees?
Yes, and we could do it before, but I don't think it would be much use. It would be completely theoretical before the 15th. So I would suggest that we set that up for that Thursday or Friday afterwards. Anybody else? Yes, sir.
Will that Zoom meeting be made available to county and city employees of the health department?
I think whoever's interested. All right.
Thanks, Jenny. So just to maybe repeat real quick, because Steve and I are going to be on that as well. Jenny has taken the initiative to call both retirement systems. This is cities. We participate in the Texas Municipal Retirement System. And then we know that the county participates in, what is it? The
TCRS.
TCRS, okay, Texas County Retirement System. TCRS, right? TCDRS, Texas County District Retirement System. Okay, well, so there's two systems, or two governing bodies, if you will, two sets of rules and regulations. So Jenny has set up a WebEx with both groups so that we can, is it just to answer questions or is it to hear from them? Do we have a prepared agenda, Jenny, or do you?
What we want to do is just have them give a rundown,
Okay.
general, and then have questions. And then my point in having them together is that they can each answer whatever the other can't about their other programs.
okay, in case somebody wants to join the city versus staying with the district. Okay. Okay, good. So both entities will be on representatives, and the day is what, Jenny? What day?
We don't have it set up yet. I'm hoping for Thursday or Friday.
Okay, next week for sure, though, you're thinking?
I don't see why not. If people are interested, yeah.
Okay, good. So next week, so, and the time, is there a preferred time for the employees, Jenny, and folks, employees? Because, I mean,
The sooner, if you guys say you want a definitive time, then the sooner I get that from you, the better I have a chance of getting it.
Chris, who has, between Steve and you, do you have access to all the employees here? Their emails or what have you?
I think there's a listserv, so we could,
Is it Chris or you, Steve? Let's get some input from you all. I'm not here today, but send email to what, Chris? Chris, do you all have Chris Anderson's email?
oh, C. Anderson, sorry.
C. Anderson? Do you all have, it's either C. Anderson or Steve Vieira.
We do have a
Should be on the
Let's pick
direct.
one though, so we don't have to. Who do you guys want to email?
You can let me,
Chris? Okay, email C. Anderson at cctexas.com. A desired time range, maybe you can do two, this is preferred, but this is another one that works. Yes, ma'am?
Just a reminder, Thursday, we do have a breakfast for the health department employees, so I don't know if it would not work for Thursday morning. Okay. On the 16th? Maybe in
Okay.
the afternoon?
Is that like a Christmas one?
Yeah.
You guys gonna have some tacos or something?
Yes.
Is it on the calendar or? Can you send me the link? It may be here. Okay, so not Thursday morning, but we'll send you, so email Chris at two times that are best for you, and then we'll see what fits most of y'all. And it probably won't be the last time, Jenny, maybe we do two, if we can. Yeah, or a few, right? So don't think that heck, if I miss that, I'm done. So let's, we'll do one for sure next week, and Jenny will talk to representatives about maybe even doing another one or two. That's a critical decision point. Yes, sir?
sorry, just to help with the administrative.
Yeah, Chris has it.
I'm being a little selfish here, but just to help with that administrative burden of collecting and collating all those times, for those of y'all that signed up for the employee focus groups and use that When is Good app where you kind of paint it over which times works best, give me a minute to create one for this purpose, and I'll have it open for Thursday or Friday of next week, and that way you guys can just select what times work best, and then that way the computer can do the work for us. So.
Yeah, absolutely. Okay, so Chris will send the link out later today, right? He'll have today, Friday, Monday or so, to kind of fill it out Monday, Tuesday, so. Okay, good, so that'll be important. We know that that's, I personally talked to some of you all outside of here on that specific question, because that retirement benefit is an important part of employment with any employer, but especially for us here in the city, so we want to make sure that you have all your questions answered on that retirement system or systems. Okay, any questions on that then, Jenny? I think that's it. So Jenny and Steve and I and Miles, the city attorney, continue to meet weekly. Some cases there's not too much new material to discuss, but we're part of what we call our negotiating team. We're going to be, as I mentioned, getting Jenny some material before Commissioners Court on Wednesday, so she can use that, maybe even a PowerPoint presentation on some of the options that we're amenable to in terms of the health department and how it's may service the county and that type of thing. Okay, good. So that concludes the prepared agenda for today, and we're going to open it up. I think we have a little bit of time. If there's any questions or comments or concerns from our teams here, we'd like to hear from you. Yes, ma'am.
So after the vote on Wednesday, is the county finally going to have a meeting with county employees to tell us what we want to do? Like where our job is?
If the commissioners,
Jenny, hold on. Let's get the
All right,
mic
right, right.
because this is live broadcast. Can you repeat the question too? Not you, but Jenny.
Let me make sure I understand the question. After Wednesday's vote, will you have direction and know what's going on, basically, right? Okay. If the commissioners determine that they have enough information on Wednesday to do the vote, they will decide whether or not to have the vote. It is on the agenda, or I believe it will be on the agenda, to allow them the possibility so that we've complied, there's enough notice. When they vote, if it's Wednesday, we'll have direction, okay? If you want to call the commissioners, let them know how you feel. That's your right.
Jenny?
Yeah.
Yeah, are there any county options yet that they're looking at that they may be leaning towards so that we can be kind of informed on what's coming? At this point, we have nothing.
Right now, there are the three options that Mr. Zanoni described.
Right.
Okay? Those are the three options that we continue on 3 tracks gathering information so that they can consider those. And until they vote, there's no, I mean, you've heard leanings from Mr. Zanoni. I can't do that, okay?
Thank you.
What did you say about the leanings?
You said they're talking to you.
All right. Right, yeah, so some of the commissioners have expressed a business model where we, the city department, would service those areas of the county that they otherwise, or the district otherwise would have to do. But that's good, so there is a meeting, so they may take a vote on Wednesday, Commissioners Court. That's good to hear this morning, I wasn't certain on that. So Commissioners Court could take a vote Wednesday on a direction forward on how they want to go forward. Right. I want to thank Jenny. I want to thank you, Jenny. I have experience in understanding healthcare districts from 20 some odd years of being in this business, but Jenny, I'm not sure has necessarily, maybe from a legal standpoint. No, she's shaking her head, but Jenny's been a great professional to work with. We've had a very positive work relationship, and that's critical, very important. So I want to thank you, Jenny, for working with us and diving in. She's had to learn the language, learn the business, stay professional, and work in somewhat of a tense situation. Jenny's done a great job, so I just want to thank you, Jenny.
Thank you.
Yes, ma'am. Okay, do we have any other questions? Okay, we have one up here, and then we'll go.
It's also kind of for Jenny. I don't, so are the retirement systems already coordinating a transfer, or is that what we'll find out on that Zoom meeting, if that will be something that is able to happen?
That'll be a question for the Zoom.
Okay, yeah, the question, just in case somebody couldn't hear it, is how much work has been done on how can you migrate or blend the 2 retirement systems? And the answer is the first meeting we'll have next week that's going to be open to the employees. That'll be a big first step. I know Yvonne has maybe talked to, have you talked to anybody in TMRS? Our human resource director on the city side has talked to TMRS, so they're aware, both retirement systems, leadership, and teams are aware of this transition. And so now we have to get into the real questions about, okay, how do we do certain things, and that'll come next week, one of those first meetings. And we have a question up front?
Oh, yes,
So-
it was just more like maybe like a thought or comment. But as she mentioned, maybe calling the county commissioners or something like that. But I also wanted to mention public comment as well during the meeting, you know, in case somebody wanted to coordinate something like that and go out there and maybe have their voice heard.
That's a good point. Griselda reminded us that in both, she's probably referring to the county, but the city too, Commissioners Court and the city council meetings, or Commissioners Court meetings, city council, there is a public comment period, so that's another way to reach your county commissioner or city council member or mayor. We do have county employees here with us this morning, just to point out. Can the county folks raise their hands? Right, well, are there any city people here? There's a lot of county. So there are a lot of county. Where's all the city folk? They have jobs. Who said that? Thank God you have those masks on, we can't tell who said that. I think there's about 50 some odd city employees, but it looks like a lot of them are out in the field today, providing vaccines and such. But look, if you have questions from the county, you can ask me, and we can get to somebody in the county as well. Sometimes, based on their schedules and public meetings, the commissioners or the council members may not always be accessible. So feel free to talk to me, and I can get to the county as well, or Steve. We're here to help both sides. This is a combined effort. Did somebody have their?
Well, I was
yes,
going
ma'am.
to, can we meet with you if, you're willing to see us? You know?
Yes. Yep. In fact, one of the, as an employee I need to meet with has expressed that desire. So work with Steve to get something on my calendar. Steve and I will gladly meet with any employee, whether you're a county employee or a city employee, whenever you want to. Okay, Gilbert?
So we're, I guess, job posting then. So in regards to vital records, will those positions, should it be transferred over to city secretary's office, will those positions be posted for the health department and then moved through the general fund to city secretary's office? Or will they have to wait to apply through the city secretary's office?
It's probably going to be the latter. So Gilbert's question deals with vital statistics, and that's the issuance of birth certificates and death certificates and maybe other records. Right now, this city, county does it in the health department, but the 7 cities, I think if we look at all 7 above us in population, they all do it out of the city secretary or city clerk's office. That's the more common business model. And our city secretary, Rebecca Huerta, has expressed interest in taking on that program. And we don't see why we wouldn't do that. They're coming to City Hall now with this transition because of COVID, and that makes sense. The cashiers are there. So that program most likely will go to the city secretary as a new area, and they'll probably expand to do what our neighboring city, San Antonio, does, which is passports as well. And so that's a good opportunity for improving it. So Gilbert's question was, are the employees going to be listed as a health department employee hired and then transition, or the other way, posted under the city secretary, hired and kept there? It's most likely the latter, where we'll put them as city secretary positions and then advertise. Somebody from the secretary's office may be involved in that interview process as well. Okay? Yes, ma'am.
Comment on that question, would that be an internal hire, or are you going to get?
No, we'll probably stick with the internal only to start. Yeah. How many employees are in the vital statistics?
Three.
There's 3? That's not that big. All right. 3? Priscilla said it's understaffed. It sounds like it to me, but 3 only. But that area is a good money, I don't know about maker, but it's a good way it does bring revenue in, so it's easy to add positions there, because if you can increase production and improve or enhance services like issue passports. Right now, people in this region, Nueces County, either go to Houston or to San Antonio to get a passport, which we really shouldn't have to do that. San Antonio has been issuing passports, the city has for probably 10 years now, I would imagine. You just go right down the street and get that, get it. Okay, any other, did we see a few more hands up, or any other questions? Yes, ma'am.
Yes, good morning. So, just something for consideration. As part of our mortality reports for COVID or any other disease condition that we investigate, we currently are able to get the death certificates, especially for those people that pass away at home or not in the hospital. That's a part of our way of keeping track. So something to consider is when moving the vital statistics to City Hall, to first maintain that relationship, because we've tried to get death certificates from other, like city councils and everything, and there's always like, oh yeah, you have to pay $25 or something like that. So just to consider that, so that we can maintain that communication as it is needed.
That's a great point. What was your name again?
Maureen.
Maureen? Sorry? Mauriam. Okay, good. Maureen, that's some of the stuff we're going to get when we do these employee work groups. Maureen was saying, hey, if you do transition vital statistics to the city secretary's office, think about a way how you can maintain a connection here with the health department, because we're the ones that deal with, unfortunately, death certificates, right, with death. So that's great. Thank you, Maureen, for that input. And that's the type of feedback that we're going to need from you all when we meet with your programmatic area focus groups. So we don't do something and then we don't factor in an unintended consequence if we didn't have that type of connection. Right, Maureen? Right. We have a question up here?
No. I'm going to back up Maureen's comment about the death certificates and even birth certificates, because I work in the STD department, and part of the surveillance part of it sometimes is to follow up on infant death due to syphilis, or follow up a child, an infant that was born to an HIV positive mother. So we do work very close hand in hand with them. So that working relationship would really be great for us to continue because some other areas that I know of, like she mentioned, do charge $25 and we can't afford to be paying $25 to.
Yeah, okay.
And we don't have to have an original copy, but just a printed, something that we can look at.
Right, okay, that's good. What was your name?
Carmen.
Carmen was just kind of piggybacking on Maureen's comments, and those are great points. I did want to point out that we're still the city, whether you're in the city secretary's office or the health department or solid waste or the police department, we're all a big family, it's all of the city. So we do a lot of interdepartmental collaboration today in our city, and that will continue. Those are good points on just that specific program. Okay, do we have any other questions? I think we're reaching about the 10 o'clock time frame. I want to make sure you guys can get back to your functions for the day. Okay, so we're going to call it a meeting. We want to thank you again for being here this morning. We'll be here next week as well, Friday. Next Friday we'll have we'll probably have feedback before then. In fact, probably Jenny send something out to the employees in total based on the county, if there's any vote the county commissioners court takes next week. So we'll probably communicate with you via email before Friday, because you'll probably see it in the news anyway, so in case you don't, we'll try to get something out to you Wednesday. The meetings are generally during the day, they don't go too much past 5, so sometimes, so maybe late Wednesday or early Thursday we'll get you an email. Otherwise, we'll see you Friday, and feel free to continue to communicate with us. We want to make sure we stress that with you. Steve Vieira is a good contact for me for the city manager's office. And then Chris Anderson, and then for the county, Jim Dorsey or myself. Okay, thank you all.
Thank you.